Hi, this is Dr. Brian Taggy, and welcome to the ENT Minute. And today I want to talk to you a little bit about pain in the ear. We talked in a previous video about some of the causes or etiologies of ear pain, and today I want to go over what you can do once the ENT physician has ruled out infection or other causes other than the musculoskeletal causes of ear pain. And remember, sometimes throat problems can also refer to the ear, and that's called referred otalgia or referred ear pain from the throat. So once those etiologies have been ruled out and we think it's musculoskeletal, then what do you do? And by the way, this is one of the most common causes of pain in an ear that's unilateral or one-sided. And so I approach it with a tiered approach, meaning stepwise. You start simple and then you progress, down to more invasive or interventional type therapies for the ear pain. Now remember, the basis of musculoskeletal ear pain is inflammation. And so what can you do for inflammation? And so my approach, and other ENTs will vary with this, but my approach is, if it's a long-standing problem, then I go with heat. Now remember, if it's an acute injury and it comes on suddenly, then sometimes ice and cold. But I'm talking more about the chronic conditions, so I start with heat. Certainly simple. I use a heating pad. Once or twice daily, I think is sufficient. Massage, and I think you can do self-massage in these situations. I tell my patients to think about a Y pattern. So in front of the ear, behind the ear, and down the neck, down this muscle called the sternocleidomastoid muscle. Those areas of massage in front of, behind, and then down from the ear are the critical areas of target. And then if those two tiers don't approach, then I progress down with anti-inflammatories and muscle relaxants. And these are oftentimes prescriptions. I only do 2 weeks at a time. These are not meant to be long-term. And then after that, you can think about more complicated or medicines that have more potential side effects like prednisone. And if the basic approach, the tiered approach, does not work, then that's when I'll consider imaging and looking at the temporal mandibular joint and referring on to an oral maxillofacial specialist that will treat these types of disorders, sometimes with splinting the mouth and relaxing the joint and the muscles and the tendons and ligaments that surround the ear in great quantities. And so that's my basic approach when it's a musculoskeletal etiology for ear pain. Thanks for joining us. Make sure you like and subscribe. We'll see you next time.